Hello, I hope all of you are hearing me. Hello? Yeah, so cool. So, hello, how are you, doctors? I hope all of you are doing fine. So, today will be a rapid revision of an interesting case of an elderly man that who had query episode of seizure, and he went to the hospital and was investigated in the ED, um, doing blood and scans, and then he was discharged from the ED, but he didn't have any clear explanation about what happened exactly to him, as well as what will be the next step. So I'll see how the conversation between him and his GP is, and what is the possible differential, and then what are the regulation and regarding the driving in such case. Okay, and then we'll give some comments and some further reading that you need to do to cover the whole topic. Before going to the case and to listen how the actor and the doctor did the case, okay, just I hope all of you are doing fine, and I hope that you are doing well with your preparation. Only a few days, 1 or 2 days, and then your exams will start. So just keep the nerve, keep doing the hard work, and hope all of you will do the best, and you will have a very good outcome, hopefully. Okay, so this is a series that I volunteered to teach my colleagues and the younger GPs, and during their preparation for their RCGP and the SCA exam. So please subscribe to my channel and also join us in the WhatsApp channel. Okay, and I'm more than happy to answer all your queries and questions. So seizure and driving, and said Mr. Beck, 55 years old, and we said that he would present to the ED after having query seizure or fainting episodes, which is very common, that you will find patients that discharge from the emergency department that unfortunately the emergency doctor may not have enough time to have clear explanation about what are the next step and what are the drawbacks of driving after having such event. And they ask the GP to have more explanation to the patient, and formulate a future plan until the definite diagnosis is reached. Okay, so let's listen. And as we did the last time, also there will be script for the case, which you can see in the screen. Okay, it might be helpful for you. Again, this script is done for demonstration purposes, not for, not for scripting, not for saving it and scripting it in the exam. Okay, this is not the right way of teaching. The best way of teaching is to teach you how to express yourself, because each doctor have his own way of explanation. So don't be scripted, okay? So let's listen.
Hello, Mr. Beck.
Hello.
Pleased to meet you. My name's Dr. Olson. I'll come and chat to you about the results of the test that you had.
Yeah, sure.
Okay. So if we just perhaps start by me asking you a bit about what brought you.
I mean, I had this sort of a collapse really at home. Unfortunately, it was at home and not at work or anything. The wife saw it, and apparently I sort of collapsed onto the floor. I can't remember much about it, to be quite honest. And so I understand I was there for a few minutes or so, and then I seemed to be coming round, and she managed to, after a little bit of a rest, she managed to get me to my feet, and she brought me to A&E, and I was admitted. And as you say, they've done all these various tests, and I've had something called a scan or other. I'm not quite sure what they're looking for. Nobody said they haven't had any results, I don't suppose.
Okay. So you're right in that you did have this sort of this collapse episode at home. I mean, it sounds very much from your wife's description about everything that happened that you actually had a fit.
A fit, yes. Fit. I mean, well, when you say a fit, what is it you're sort of meaning? I mean, you know, you sort of, I always think of animals and puppies having fits and things. I mean, is this a mental thing?
No, not. Well, it depends a bit what you mean by mental, but basically what's happened is that you've had this collapse, and then you've had this sort of shaking episode on the floor, if you like.
Yes.
And then afterwards, it took you quite a while to sort of come back and be back to rights and back to normal, really.
Yeah.
So animals, they do have fits, and other people can have fits as well, but that certainly sounds as though that's what happened to bring you into hospital. Right,
okay. And do the test results sort of confirm this?
Yeah, so really the important thing for us is the description, the really clear, good description that your wife gave about what happened, so she saw that you had a fit. And then when you came into hospital, our sort of job was to find out why that had happened. So if there was any problem that had caused it, if you like. So you mentioned that you had a scan and that you had some blood tests and stuff. Okay.
Yes.
And so those investigations were all okay, actually.
Oh, good.
Yeah, so the blood tests were okay.
Right.
And the brain scan was okay.
Good.
That means that we've not seen a particular problem that might have caused you to have the fit.
Oh, right.
So sometimes, for example, if people's blood tests are a bit off, or if they have a problem in the brain, like something nasty like a tumour, that can cause them to fit. But we've not seen any of those problems in your case.
So you've not actually found any. Well, like you said, you've not found any problem at all.
So we've not found the reason why you've had to fit. So there doesn't seem to be anything that's caused it. But you certainly sounds as though you have.
But I've had it. Oh yeah. I had a slightly, about a little bit earlier, sort of a little bit faint. But I mean, that was just at home, and it sort of quickly passed. I don't know if that was any connection.
Was that before this episode?
Yes.
Okay.
Yes, a little, a few days or so before. But I mean, that was nothing neither here nor there. I just thought, must have moved too quickly or something,
So did you collapse on that?
No, nothing like that. It just cleared. I didn't think anything about it.
Okay.
It was this one. But I mean, in a way, you say you can't find a reason for this, but I mean, is it possible that it could happen again?
Yeah. So have you ever heard of the term epilepsy? Have you ever heard?
Oh yes.
So in the condition epilepsy, people can have fits, and there's not a particular reason like we found with you. There's not anything like a tumour or any funny blood tests that are causing it. It's just something that happens to people. Like some people end up with diabetes, some people end up with heart problems, some people can end up with epilepsy.
So you think this might be epilepsy then?
I mean, it sounds to us as though that's potentially what the problem is in that we've not found any reason why you've had the fit, so there's no problem that's caused it.
Would I have to be on, these injections and things?
Well, what epilepsy is normally dealt with by neurology or brain and nerve doctors.
Yeah.
Okay, and they're sort of specialists in this field. It's not always necessary to be on tablets straight away if you've just had one fit, but they'll need to do some more tests and then to review things and to decide really the best way to sort of treat you for this.
Yeah. Okay, so I'll be stopping in hospital some longer time, will I?
Well, you don't need to necessarily stop in hospital for all those tests, but what we do need to do is to hook you up with an appointment to come back for them, and also an appointment to see the neurologists, to discuss things and to discuss about treatment and all those other things, really.
Right.
So they're the ones who are going to be able to talk to you about that in more detail.
So, I mean, it's just happened the once. I mean, well, what about the job situation? Because, I mean, as I said, when this happened, I was at home when I collapsed, which was fortunate. I'm actually a minicab driver, and obviously I wouldn't want this, if any chance of this happening you know, obviously while I was driving, would it? You know, but equally it's my my living, you know, to support the family and everything. Something I need to do. I mean, can you sort of, in any way from your tests, predict whether it might happen again, or just a one-off?
Unfortunately, we can't, not with the information that we've got available. And as you've sort of said, and as you've highlighted, you know, it would be potentially a very serious situation if you were to have another fit, particularly a fit when you were driving.
Yes, yeah.
And for that real reason, there's some rules and regulations in place regarding driving after you've had a fit. And that's something that I've sort of got to talk to you a bit about now, if that's okay. So the DVLA, or the people who govern our driving and our licences, say that after you've had a fit, you can't drive straight away afterwards.
No.
And it's really for a minimum of 6 months, depending on some of the investigations, but potentially up to a year after you've had a fit before you can drive any sort of vehicle again.
Well, I mean, that's bad news for me and, you know, my job, because as I say, basically, you know, as a minicab driver, I'm self-employed.
Yeah.
You know, I know we have these names on the side, but I mean, that's purely booking. Effectively, I work for myself. No driving, no money coming in. So who would tell the DVLA? Would I have to tell the DVLA?
Yeah, so it's your responsibility to tell the DVLA that you've had a fit, and so that you're not able to drive. Okay, and then it is a legal requirement. It's not just sort of our rule. It's not something we've made up.
No.
It's a legal requirement from the DVLA that you aren't allowed to drive after you've had a fit.
So yeah, I mean, do you think it might be worth? Oh, I don't know really. You know, you can see my problem, can't you? That you know, as a sort of the main you know, wage earner and everything, and you know, it is a very, very difficult one how to do, because I'm not quite sure what other work I could do. You know, if I wasn't driving at all. I mean, I don't know. I mean, would it be worth me, you know, if I continued driving and seeing if I don't know. I don't know what to do.
That definitely wouldn't be a good idea, and isn't something you should do. As you said already, it could be very dangerous if you were to drive and have a seizure. You could have an accident and hurt yourself and other people.
Yeah.
So you really mustn't drive, and if you were to drive, then you know you'd be going against those regulations, and you'd be invalidating your insurance and everything. So it's a very serious situation, and really isn't something you should contemplate.
No, but equally I would say it's a situation I can't see my way out of, you know, given the sort of time scale. You say 12 months, did you say?
Up to 12 months. It depends really. You have to be it's a minimum of 6 months, depending on some other investigations that the neurologist would do.
Right.
But obviously if you were to have a fit in that period, then you know
to start all over again.
Yeah, exactly.
The long time scale.
And it's purely for a safety reason. That's all the rules there for. It sounds to me as though the main concern about not driving is because of your work.
Yes. I just don't know what to do in this situation. You know, where am I going to go? Or, you know, I mean, I can only think I'll have to try and find some other job if that's the case.
Well, I'm probably not the best person to advise you about specifics, but I can put you in touch with our social work team, who can direct you, you know, where you might go to sort of think about the right sort of benefits while you're unable to work, and also in time to think about, you know, what other work you might be able to do, and whether or not that would involve, you know, retraining in a different field. But you know, that's quite a big sort of thing to be thinking about, obviously. And
something I'll have to think about, though, isn't it, really?
They can certainly help you and direct you in the right place to go and find out the information you need, the sort of the support that you need while you're unable to work.
I'll have to do this, and maybe some of my mates and, you know, other drivers and people have contacts or so, or you know, I'll have to do something to get money coming in, and equally I don't want to risk the licence or anything. So right, okay, well, that is not you I'm glad you've not found anything in that sense, but equally it's a little bit vague in the sense we don't know whether it's all going to happen again. But I'll just have to wait and see.
Okay, so to just sort of quickly summarise the points I've made, I think that's important, is that you've had this fit and we think it might be that you've got a condition called epilepsy. So for that, we're going to be referring you to the neurology doctors, who are the specialists in this, and will talk about other investigations and treatment. And the second important point that we've covered is that the fact that you can't drive after a fit, and that's a regulatory requirement. The other thing that I just want to quickly sort of run through with you is about other sort of safety things if with fits. And there's obviously some situations where to have a fit would be much more serious than others.
I suppose, you mean banging your head and things.
For example, I think particularly until you've seen the neurology doctors and we know where things are up to, you should be a bit, extra careful. And so I would advise, don't put yourself in any situation where if you were to have a fit, you would come to harm. So don't go doing things like climbing ladders or trees or...
No, I wouldn't do that.
Would say to be very careful about things like swimming on your own, or to go into if you were to take a bath,
You mean an ordinary bath?
An ordinary bath, because if you were to have a seizure in the bath and no one was able to get in to help you.
Oh, crikey. Well, I'll stick with showers then. I should be all right with that, shouldn't I?
Yeah, so I would just, when you're doing things, I don't want to alarm you, but at the same time, I want you to be safe. And so just be thinking about things and when you are doing things, just have that in the back of your mind and try not to put yourself at risk. So I would say particular care about climbing to heights, not to do that. And about things like bathing and swimming pools, those sorts of things. Just so if anything untoward were to happen and you'd have a seizure, you wouldn't be putting yourself or anyone else in danger.
Okay, well, I'll bear that in mind and we'll see what happens.
All right.
Contact the DVLA.
Okay. Good.
Okay.
Is there anything else you want to ask me at this time?
Not at this stage, no.
Okay. All right.
Thank you, Doctor.
Okay, thank you.
Yeah, so interesting conversation, and I think it's very swift and really done in very good manner. However, if I would do the case, I will just add a couple of things just for completion. Okay, I would explain to the patient what the secondary care will do in terms of investigation, like EEG and what is EEG is, and maybe probable MRI. Okay, the other thing also, I will double check what the emergency department have done and go through the history. I might also consider, discussing with the patient, avoiding alcohol or excessive alcohol, caffeine, energy drink, and as well as, the sleeping and how he's sleeping and, sleep deprivation. The other thing I would consider also safety netting and patient education regarding what, and even the relative, what they should do if he had a seizure again at the home, left lateral, position. Okay, if there is need of rescue medication like diazepam, rectal diazepam, or buccal midazolam, and when they should contact 999 and then call for the ambulance and for help. So that I would include it on the discussion with the patient, according for sure to the availability of time. Okay, and then I would imagine when I'm studying such case, I would imagine then another case scenario if the patient is adamant and refusing to inform to stop driving. Okay, so what will be then the case scenario, and how can I convince him to stop driving? Okay, and what are the regulation, and how can I take the things further step? Okay, and do I need to call the MDU? Do I need to contact the DVLA myself? What about confidentiality? And that's something that you need to think about when you're studying such case scenario. Okay, The other thing is for sure the reviewing the DVLA regulation regarding Group 1 and Group 2 car drivers and epilepsy or fainting. Okay, it's just that's that these all regulations are available online. Just I want to clarify what is the main difference between epilepsy and seizure. Okay, so epilepsy is the diagnosis itself, and it's either primary or secondary epilepsy, but the seizure is in the fit attack. Okay, the patient might have a fit, but that doesn't mean that he have an epilepsy. So if the patient have an epilepsy, if an epilepsy, this means that he have the diagnosis of epilepsy. If in the guidelines see that seizure mean that he still doesn't have the diagnosis of epilepsy, and both of them can be either provoked or unprovoked. And what does it mean provoked? Provoked means that it's either induced by alcohol or medication or even an infection or head trauma. That's mean what provoked. Unprovoked mean that there is no specific cause, no electrolyte abnormality, for example, cause that the seizure or the epileptic activities. Okay, that's also some, just in case if you are reading um the guidance, and then you started to wonder what they mean by provoked and unprovoked. Okay, you can review this, these two slides in your leisure time, and then also for completion, I would consider studying what the difference between seizure and pseudo seizure, and what does it mean pseudo seizure, and then causes of dizziness and fainting, and what the patient mean by dizziness. Okay, is it vertigo? Is it syncope? Is syncope? And what is the difference between true vertigo and pseudo vertigo? And then what is the difference between central and peripheral vertigo, and then what might be the causes of the central vertigo? Is it stroke? Is it basilar migraine? And what are the causes of the peripheral vertigo? And for example, how I can differentiate between paroxysmal positional vertigo, between labyrinthitis, between vestibular neuritis, um, and Meniere disease. Okay, which is important, and it's common to be seen in the primary care. Okay, what are the important bits in the history taking that I need to, emphasize and gain during the first half of the consultation, actually the first 6 minutes, and then also what is the definition of Meniere disease, and how can I explain to the patient Meniere disease or paroxysmal positional vertigo, which I think a lot of doctors might find it is a bit of a struggle. That's you need to think about it, how you can explain to the patient such disease, and then the treatment of each of these, and what are the treatment of each category of these diagnoses. Okay, and lastly, what is hint disease, what is hint examination, and what is the uses of the hint examination. Okay, which is the head impulse, nystagmus, and test of stew. That's also very important, and usually I go in depth and details about each of these diseases in our webinars and in our courses. Okay, so I hope that was just a rapid review. The aim of this videos is to be short and specific, and we might consider taking these in details, okay, in the free teaching in Wednesday. So please tune up and keep watching our YouTube channel, and please join me in either my SCA level up YouTube channel, or my Telegram, or even the Facebook group or the WhatsApp group. You are more than welcome. Okay, and be aware that we are doing webinars, okay, with very small fee, as well as I'm doing one-to-one teaching for many mocks, 6 cases back to back, or even 12 cases, and for sure I'm doing one-to-one hourly teaching also. All of them are um, in an economic price and affordable price. Okay. Uh, Please, doctor, if you have any question regarding today discussion, put it on the comment in the YouTube channel, or even directly WhatsApp me for any further questioning or help and support. Okay, I'm more than happy to get your question, and I will answer it as always in the comment section in the YouTube channel. Wish you the best of in the incoming exams, okay, and then stay tuned, okay, enjoy the learning, and then keep positive, and you will succeed. See you.